Hello, everyone. I'm Lisa Ling, and this is The Road to a Vaccine, an exploration of the COVID-19 crisis and the global community's efforts to develop a vaccine against the disease. We are coming to you live now, and I invite you to ask questions. And if you want to do so, put them in the comment section, and we will try to get them answered by our experts today. Let's take a look at the numbers this week. As of today, there are over 31 million cases and over 960,000 deaths globally. In the US alone, we've reached almost 200,000 deaths. In September, India has seen many days with over 90,000 new cases per day, and European countries are expected to impose more restrictions as cases continue to rise rapidly there. Meanwhile, here in the US, the CDC has reverted to its previous guidelines, removing language saying that the coronavirus could be transmitted by tiny particles that linger in the air. It was a mistake, they said, and it wasn't ready to be posted. It was just another example of some of the many confusing attempts at disseminating COVID-19 health information. Now, we've been on this road for a while, and one topic that we're getting constantly is about COVID and children. There's still a lot of confusion about how dangerous COVID-19 is for kids who get sick. And now that school is underway, many educational institutions are opening their doors to students to learn in person, while others are still teaching virtually. The question of whether to send kids back to school has unfortunately become a difficult situation in many US states as schools balance the need to reopen classrooms against concerns about the risk for students and faculty. For more on this, we have a pediatrician's perspective. Today, we will have on Dr. Sam Maldonado from the Pediatric Center for Excellence at Janssen, and he'll fill us in on what we do know about kids, families, and COVID. And certified nurse Robin Cogan, also known as the Relentless School Nurse, will share why she thinks our schools are becoming part of the largest public health experiment ever. And what's it like to be a college student right now? We'll hear from journalist, advocate, and former Glamour and Self magazine's editor-in-chief, Cindy Levy, and her daughter, Lucy, about what it's like to go to college for the first time in the middle of a pandemic. But first, I want to welcome Dr. Sam Maldonado. He's a children's infectious disease specialist and a VP at Janssen to the show. Dr. Maldonado, thank you so much for being with us. I'm sure you are being peppered with questions about kids and COVID pretty relentlessly. And there's a lot of misunderstanding and misinformation about how COVID affects children. So what do we know for sure about how this coronavirus is affecting kids?
Yes, thank you, Lisa, for having me. Yeah, this coronavirus is similar to other coronavirus that cause upper respiratory infections in children and adults. This particular COVID-19 also causes upper respiratory infections in children. The good news for children is that it's less virulent, causes less severe disease in children, and some children may be infected even without having symptoms. That we know. However, there are some that get infections, and there is also a finding of a multi-system inflammatory syndrome in children that is very unique to children. It may happen a few weeks after being exposed to COVID. Fortunately, this is a rare syndrome. About 800 cases reported in the United States until now.
And doctor, how does that manifest itself in kids?
Yeah, the multi-systemic inflammatory syndrome, there is already what we call a case definition put together by the CDC. Is fever that lasts at least 24 hours, vomiting, diarrhea, pain in the stomach, skin rash, redness in the eyes. So these are some of the symptoms, and the kids look very sick. They are severely sick. So they need to be seen by a physician immediately. Now, if they also are lethargic, that very difficult to wake them up, or have difficulty breathing, chest pain, confusion, they need to be seen in the ER, in the emergency room, right away. But as I said, it's rare. It's only 800 cases in the United States in children. And when I say children, it's of all ages, but mostly between 5 and even young adults, 22 years of age.
Dr. Maldonado, there was a recent study published in the Journal of Pediatrics that suggested that children carry a higher level of virus and are therefore more contagious than adults. Can you explain what this means and how children might actually be contributing to the spread of the disease even while asymptomatic?
When we test when they test respiratory secretions, we call that viral loads. Indeed, the study in the Journal of Pediatrics found a higher viral load, but that's not unique to this coronavirus. We see it in other viruses, respiratory syncytial virus, RSV, which is another virus that causes disease in children. So the problem with that conclusion is that many of these viral particles are not necessarily infectious, because all we test with the test is viral particles. Some of them may be actually only pieces of the virus, of the coronavirus. So they are not necessarily infectious. In order to make the link that viral load or increased viral load causes more transmission, the study needs to be made. So I wouldn't conclude that, but it could be a hypothesis, but I wouldn't conclude that that's the cause. Now, why children may be more infectious is because they are asymptomatic, meaning no symptoms, or because the symptoms are so mild that they are out and about. And because they are out and about, they are more in contact with people. But that doesn't apply only to children. Even adults who are asymptomatic may be good transmitters. When I said good, maybe the ones that transmit more of the disease.
Do you think the reason why the data is so inconclusive when it comes to children is because children aren't being tested very regularly?
Yeah, the testing has been and there are many localities that have been only indicating testing when the patient, how the individual has symptoms of the disease. And since children may be asymptomatic, so many of them are not being tested. So those numbers that we have about children, 500,000 children diagnosed with COVID, is most likely an underreporting. There may be more than that have been infected, but we just don't know. And probably even the children and their families don't know.
I mean, doctor, this just seems hugely concerning to me. I mean, because kids aren't getting tested and they may be infected but asymptomatic, yet schools are starting to open increasingly more so in the US. I mean, is there anything that we can do to try and figure out whether these kids are carrying the virus other than testing?
I mean, without testing, we won't know. But then the question is, should we test all the kids going back to school? Probably we may not have the capacity to do that. It's a very difficult question. I know some institutions do testing routinely. When I'm calling some institutions, it's some companies that want to test their workforce, especially those that have to go back to work. But schools, ideally, that should be the case if the testing is not invasive, but we're just not doing it. And I don't know if we have the capacity. One of the reasons why testing has been only indicated for symptomatic people is because there has been lack of those test kits.
From a pediatrician's perspective, do you think that it should be imperative for kids to get tested, young kids, if they're going to be going to school?
It is. Sometimes when we do testing, we really try to ascertain is it appropriate to test? Are we going to have a lot of negatives because we're going to test the general population? So I think that there should be protocols on how or when to test kids, even when they are asymptomatic. For example, if in a city or in a locality where the virus is circulating in high numbers, it may be more appropriate to be more aggressive about the testing of children. In some localities where that's not the case, it may not be warranted to do that. It might be just too invasive.
Before the show started, you and I were talking about how your sister is a teacher in Texas and she contracted COVID, but she doesn't know definitively if she got it in school because none of her kids in class were exhibiting symptoms and they didn't test. Is that
Yeah.
correct?
Yes, my sister, of course, was isolated or self-quarantined over the summer, just like everybody else. 1 week after going back to school, and she teaches very young children in elementary school, very young, meaning about 6 years of age. Um, and just 1 week of being in school, she became very symptomatic and went to seek medical attention and was diagnosed, positively diagnosed with coronavirus infection. Of course, she stopped going to school. She's not aware of any of the kids in her classroom being positive for coronavirus, but that's, again, not surprising. It may have been that she had acquired there. It could have been in any other place, but the likelihood is probably higher there because it's a high concentration. And it was, as I said, 1 week after, the first week that she went back to school. And of course, she gave it back to family members who live with her. So these are some of the risks of going back to school. Now, having said that, we all recognize the importance of children getting back to normal as much as possible. So it's a trade-off, no doubt.
Yeah, I mean, it is so true that teachers really are becoming the new frontliners. You mentioned plans and procedures for schools to open safely. So what would you say needs to be in place in order for a school to reopen safely?
Yeah, again, knowing the locality, because the virus doesn't circulate with the same numbers in every locality in the country. So knowing the locality, it's important. Being more aggressive in terms of testing in the localities in which this virus is circulating more, and the same protocols of hand washing and disinfecting surfaces. Now, with children who are very young, that's very difficult. I asked my sister what happened. Were they wearing masks? And she said, yeah, they were wearing masks, but a 6-year-old might not be able to tolerate wearing their mask the whole time that they're in school. So there are schools that have opened with very strict protocols of safe distance, also making sure that the same group of children are with the same teacher and they're not mixing classrooms. And also they pick up, the parents going to pick up their children, they have to follow certain protocols so that make sure that the parents don't come in contact with each other. So there are protocols that can be in place to, as much as possible, protect the children, parents, and staff in schools.
Dr. Maldonado, Adrian from Facebook asks a question, which is, can you talk about the flu season and the impact it can have when coupled with the COVID-19 pandemic? And are there things that parents should be looking for in trying to disseminate or differentiate between the flu and COVID?
You won't be able to differentiate, even good clinicians won't be able to differentiate between COVID and the flu. The symptoms are pretty much the same as fever, and nasal congestion or runny nose, cough, sore throat, shortness of breath. All of that happens in both viruses. So there's no way to discriminate. The testing will be the one that will tell you or the clinician if it's flu or coronavirus. But so it is important to pay attention. As a general rule, any child or adult with upper respiratory infection should self-quarantine. Not go to school, because even if it's not coronavirus, if it's flu, it's an appropriate thing to do, not to transmit to others.
How would you say parents should evaluate whether to send their kids back to extracurricular activities, like team sports, or even play dates?
Yeah, that's a good question, and I think we don't know for sure. It all depends also, again, in how the virus is circulating in communities, what type of sport, are the players sharing equipment, it's the sport inside or outside. The American Academy of Pediatrics put a guidance in healthychildren.org about doing these extracurricular activities. And there's a good guidance to read, because they consider all the different sports and all the different situations in the sports. Some sports, of course, are more contact sports that will have a higher risk. But again, extracurricular activities are important, and they should happen, but they should happen with this care in mind.
I have one more question from Jamie from LinkedIn who asks, is it easier to test a child or just go by symptoms?
Actually, because children, apparently in some studies, not only the one in Journal of Pediatrics, but in other studies, children shed the virus a lot, probably even more than adults. So it's easy to test, but you have to have access to the test. Symptoms alone cannot, even the best clinicians will not be able to differentiate between this coronavirus, COVID-19, other coronaviruses that also cause upper respiratory infections, because this is not the only one, or the flu. So clinically, as we call it clinically, meaning by looking at the child, examining the child, it's impossible. You have to do the test.
Dr. Maldonado, we really appreciate you being with us today. How's your sister doing?
Oh, she recovered fully after a couple of weeks of not being well, but thank you for asking. She's back to school.
We're glad to hear that. Thank you so much for that dose of clear and accurate information on kids and COVID. That was Dr. Sam Maldonado. Thank you. This is The Road to Vaccine, and we are coming to you live. If you have any questions for our guests, leave them in the comment section, and we will try to get them answered. Now, when it comes to kids and COVID, there are many ways this pandemic is affecting all of us. We talked about science, and now let's take a look at a personal story.
Pandemic parenting is different because you don't get a break. And all the parents out there know it doesn't matter how much you love your kiddos, we need a break. We were all quarantined in a one-bedroom apartment, the three of us, for 3.5 months in the city. So we had to get real creative. I even tried to learn how to bake with my kid, and it was a hot mess. I do worry about his socialization. He's a really outgoing kid. Although he doesn't have a ton of play dates, he's getting to spend time with his grandparents, which never would have happened in our old lives. So that's been a real silver lining. I'm just amazed by my kids' resilience, and I'm amazed by our resilience. Although this was never the year we could have expected, we've made a lot of amazing memories, and I think if we can get through this, we can get through anything.
So many super moms have emerged through all this. Thank you so much for sharing your story. I now want to welcome former editor-in-chief of Glamour and Self magazine, Cindy Levy. She is an author and activist for women, and she's here with her daughter, Lucy, or actually her daughter, Lucy, is at college right now, and she just started her freshman year. I'm sure many of you can relate. Cindy and Lucy, welcome to the show. Cindy, I know Lucy is your firstborn, and you've just sent her to college as a freshman in the middle of a global pandemic, as if it weren't hard enough to send a kid away to school. How have you been feeling about everything? And particularly, what are the ways in which her university has been handling COVID?
Oh, I'm super relaxed, Lisa. Why would you ask? No, I mean, as you say, it's obviously nerve-wracking. Like there's that old cliche about how when you have a child, you decide to have a child, you're agreeing to forever have your heart walking around outside your body. And now it's like having your heart walking around outside your body during a pandemic. So there is a whole other level of stress to it. I mean, I think for us, what was most speaking for myself, and Lucy may have a different answer, what was most anxiety provoking was all of the uncertainty for months about whether she was even going to be able to go, and would it be safe for her to go? Would the University of Michigan, where she's a student, consider it safe? Would we consider it safe? There was a lot of back and forth. And I think once we made the determination that she was going to be able to go, even though there's a lot of anxiety about it, there was also for us this like sense of relief, because we lived in New York, so we were in incredibly strict lockdown all spring. I mean, not unlike the story that you just heard from the woman before us, who was, in a one-room apartment with her family. That was us. And so there was no prom, no graduation, no summer jobs, really nothing. And just the fact that she was able to actually go was wonderful.
And Lucy, tell us what it's like from a student's perspective. I mean, you're living in the dorms. I saw your roommate just give you some space, and she graciously left so that you could do the show. What's the climate like there for students, and how have you been navigating basic things like having a roommate and studying and socializing?
Yeah, it's definitely difficult. I would say it definitely varies day by day, the mood on campus. I would say, like my mom was saying, I think most students are really grateful to be here when it comes down to it. I think a lot of us were not expecting to come, or just we had no idea what this fall was going to look like. Or now I've been here for almost 4 weeks, and I think almost all of us thought that we would be gone by now, that they would have sent us home. But I think in general, people are really excited that at least they get to make the most out of the situation. That being said, it is really difficult to navigate basic things like having a roommate. I live in a beautiful dorm, the most beautiful building with tons of open spaces that are normally used for studying and everything like that. And they're all closed now. So essentially, we have to spend all day in our dorm room with our roommate also doing classes at the same time. So it's definitely difficult. And these are things that under normal circumstances we would probably not have to deal with, being on phone calls all day at the same time as someone else in the same room. But it's definitely a memorable experience. It it definitely leads to some very intense bonding with the people around you. Like I've gotten very close with my roommate due to the amount of time that we're spending together. And just in a broader sense, social things on campus are super bizarre, honestly. I think there's a lot of tension within the student body because, most students are
Students
making
want to go
huge
out and
social
have fun, right?
sacrifices.
Yeah,
Exactly.
students
And
want
a
to go
lot of
out and have
people
fun and socialize.
a lot of people aren't doing that because, it's smart. There are a lot of really smart kids at this school, and a lot of people are making the choice to opt out of those things. But um, on the other hand, there are kids who are kind of thinking, I think, in a more uh, short-sighted way, still wanting so badly to experience all those typical college things. And I think that leads to a lot of tension. I think the kids who are making a lot of social sacrifices and giving up a lot of um, the fun things that they would have otherwise are very resentful towards the people who are indulging in those things anyway, as much as they possibly can. And that creates some awkwardness, I would say.
Well, we've been hearing a lot about college students continuing to party, and some of them are getting infected with COVID. Cindy, when you read these reports, does that compel you to check in with Lucy more? I mean, do you think that you are checking in with her more than you would otherwise?
I mean, I think we've been in pretty close touch these past few weeks, probably more than we would have otherwise. And I will admit that I do, quite regularly check the COVID database at the University of Michigan. And, I read all those stories in the Chronicle of Higher Education, which I had never picked up before. I guess what I would say is when I hear, things like what Lucy just shared about how some students are being less cautious than others, even though, it's clear that that's not what's recommended. Of course, that makes me nervous. I do wish that the university was testing its student body, which is something that I think is probably happening more often at smaller colleges and less often at big universities, but would probably give a greater, sense of comfort. So yeah, I worry, but at the moment the reported infection rate at the school is relatively low, and we live in a big city, so if she weren't there, she'd be here. So I'm pretty comfortable.
Lucy, your mom said that she wishes that the school would test more. I mean, what are the testing protocols at your university? Are people getting tested regularly?
So essentially, before everyone came to campus, they sent us a testing kit to each of our houses that we had to do a test by ourselves and then send it back to the diagnostics place. And then as soon as we got our negative results, as soon as they came back, we were cleared to come to campus. And since then, the majority of the student body has not been tested. I, for one, have not been tested since I set foot on campus, which I'm very surprised about that. I came into this semester under the impression that I would be tested on a regular basis, just because some of my friends who went off to college before I did, you know, their schools were testing them once or twice a week, testing everyone once or twice a week. And
Lucy,
that was
is it
definitely
accessible
something.
is it accessible if you wanted to get tested? Would you be able to do so easily?
Um, Unfortunately, I think it's kind of a difficult process. I guess uh, this did come as a surprise to me, but I guess they have somewhat limited resources, at least in comparison to the great amount of students that they have on campus now. But they have certain criteria for if you do want to get a test. And I know some people have felt like they've been exposed, or they feel that they are particularly vulnerable, and they have, you know, gone to the health center trying to get a test, and the health center unfortunately says that will not be possible at this time. So I know of a lot of students going to private clinics off campus, you know, in the Ann Arbor area, and that obviously gets the job done, but it is there are some problems that arise as a result of that, just because then those students aren't required to report those results to campus, like to the campus health center, and that obviously skews the student data on these databases that my mom was talking about, and that makes things difficult.
Cindy, does that make you nervous when you hear that there's some inconsistency in how accessible testing is at that university?
A little bit. I mean, you know, again, if you look at the reported infection rate, it's not leading me to panic at the moment. But yeah, I think there should be, you know, more consistent and widespread testing.
Lucy, we have a question from someone who's watching right now. Remy from LinkedIn asks, Lucy, have you been taking care of your mental health on campus during the pandemic? And do you have any advice for other students? I mean, your mom mentioned that you weren't able to go to your prom, you weren't able to attend your graduation, and now you're going to school for the first time under really unusual circumstances. So have you been taking care of your mental health?
It's definitely a struggle, I would say, a struggle day to day. But I think what I'm really trying to do is just take everything, you know, minute by minute, just really focus on what's here right now, not what could have been or what should have been. My mom always gives me this advice. We were just talking about this, how, you know, nothing's ever gonna work out if you are constantly thinking about this is so much worse than it could have been, or I feel so robbed of what could have been. And that's sometimes how I'm inclined to think, but I think it's made it a lot better since I've started trying to live more in the present. And obviously that's very difficult because every day walking through campus, I'm reminded of the things that aren't available right now, but I'm just trying to think about it in a more, you know, like I said, day by day way, hoping that soon everyone's sacrifices will amount to something good, and they'll pay off, and we'll get back to normal, or the new normal, or whatever.
Have students been pretty compliant, at least about wearing masks when they're around other students?
Yeah, I would say for the most part, yeah. And you know, when you're walking around campus and you see someone who's neglected to wear a mask, it's kind of like, it's very surprising to see, and everyone kind of gives them weird looks, which I think
gives them the stink eye.
Yeah, it's for a good cause. So
yeah. Look, I know this is not a typical college experience, and not the typical rite of passage that you would expect, but is there any advice that both of you can give to people who are in the same boat, who are contemplating whether they can safely send their kids to school? Cindy, I'll start with you.
I mean, I think my big advice is really what Lucy was just alluding to, which is like, you know, it's so hard in these moments when you're doing something that's this big rite of passage, the way going to college or taking your first kid to college is supposed to be, not to like have the vision of what you thought was coming your way in your head. And I think, you know, if the last 6 months have taught us anything, it's like we just have to let go of that, and, you know, and just try to not constantly be comparing to whatever you thought that milestone was going to be. And then I think my other advice is just, you were asking about mental health. You know, it's so tempting in this situation to just like be inside on your computer screen all day, be sedentary. And it's so important, as much as we all can, students and parents, to be like getting outside, try to be in community with other people in some way that is safe, just to, you know, just to sort of keep us afloat, hang on to those habits.
Lucy, how about you? Do you have any advice for parents and students who are contemplating these decisions?
Yeah, I mean, I guess I totally agree with what my mom said. That's really what's been keeping me grounded since I've been here. And I also just think as a student, it's really important to remember that this is a very difficult situation that we're in. And everyone is really working really hard to find ways to make it work for themselves. And it's really tiring. So I think it's important to, you know, give yourself some credit. Obviously, given the circumstances, everyone is bound to stretch themselves too thin sometimes, trying to, you know, even though it's really hard to make friends, trying really hard to make friends and trying to socialize, even though we are not supposed to interact with anyone we don't know. Like, these things are really, really exhausting. And I think it's definitely worthwhile to give yourself a break sometimes and to tell yourself that you're doing a good job and that you're trying as best as you can. So I think that's
Cindy
important.
Levy and Cindy Levy, thank you so much for being with us. Lucy, I wish you so much luck. I mean, the one thing that I will say is that this is such an unprecedented time that you will tell your kids about one day, your kids will tell their kids about one day. I mean, we certainly are living through history, which doesn't probably doesn't make it better in the immediate presence, but you know, we're all in this together, and I truly wish you the best. Thank you both so much for joining us.
Thank you, Lisa.
Thank you.
Now, in case any of you are joining us, this is the Road to a Vaccine, and we're taking your questions throughout the show. Now, one group that's being adversely impacted by the pandemic are the new frontliners, school teachers and staff. Here to talk more about what's happening in our schools is certified school nurse Robin Cogan, and she's in her 20th year as a school nurse in New Jersey and has a very popular blog as the Relentless School Nurse. Robin, thank you so much for taking the time to be with us. What would you say is happening in different school districts across the U.S. and globally, and how are teachers overall adapting to remote learning?
So many important questions, but first, thank you so much for having me and really giving voice to school nurses. I loved hearing this mother-daughter discussion. It really is important to recognize that we can support our children as parents, as teachers, as school nurses. You know, we're all in this together, and some of the divide I think that's going on is because what's happening at home is not necessarily happening at school, and some of the issues that are happening at school in terms of being able to implement these important public health mitigation strategies is because families aren't necessarily following up on those things at home. And so school becomes a place that as much as we want to provide the support and the safety, we are coming up against some very concerning behaviors that are happening outside of school that are directly impacting school. And so school looks different in every single state, in every single county. It's, you know, we don't have a national response to COVID-19. And if we did back in March, I don't think we would be having this conversation today.
Well, yeah, you look at so many parts of the world where they've gotten the virus under control and their kids have been going back to school. And,
Right.
and some of these countries, Taiwan is an example, they didn't even shut down their economy because they had a consistent message from the beginning and people followed the guidelines.
And that's what we've been missing. And sadly, we are at a place now of 200,000 people have died. Just what happened in the last few days, Lisa, with the CDC, once again, the confusing communication and messaging, those things erode the public trust. And when the public trust is eroded, that seeps into school. When we're trying to encourage everyone to maintain the 6 feet of distancing and wearing a mask and washing your hands and sending children home with 1 or 2 symptoms, but families are not buying into it because on a national level, we haven't bought into it as a country. That's where the divide is happening. So
well,
I
yeah,
guess
I mean, the polarization and the politicization of everything. I mean, it's inevitable that children feel it because there has been so much consistency. One of our producers just sent me a text to say that the U.S. has just surpassed 200 deaths related to COVID as we've been on the show now. Robin, what are the biggest challenges for kids right now? Are they failing behind? Are they missing out on socialization? And how can we help our kids?
I love that question because that's the point, right? We want to be able to support our children and our families. And schools have always been the heart of a community. And so, being separated from classmates has been probably the most challenging and complicated factor. And being separated from teachers and being separated from school staff. School plays such an important role in this country. And the fact that we have to physically separate, I think one of the things from the beginning of the COVID is that the public health messaging was confusing. We should have never called it social separation. It should have been physical. We should be physically distanced, but socially connected. And so those kinds of messages really added to a misunderstanding of what the things that we needed to do. I think another issue with our students, truthfully, I think we're all feeling this way. Motivation is at a low. People are feeling this malaise because we've been at this now for 6 months. There's no reason for this. When you look around the world, other countries have handled this and they've handled it as a nation. They've handled it as a community. They have not kicked it down the road to the individual states, to the individual counties, to the individual cities who truthfully don't have the public health expertise to manage this. I mean, just in New Jersey alone, my state, who has done a very good job, let me say, and we've been in the midst of, at the very beginning, New Jersey was in a complete crisis, number 2 to New York. But we have 584 school districts in New Jersey. Do you know that every single one of those districts had to create their own plan around contact tracing, around reopening schools? I know it's never a one-size-fits-all, but there are certain things that should have been standardized so that we're not questioning every decision that's being made, and that those decisions are being made around safety.
Yeah, 6 months into this, we still don't have widespread contact tracing, and we're still leaving it up to individual jurisdictions to figure out, which is just ludicrous to me.
It's bananas. And we also, the infrastructure isn't there. We haven't invested in public health in decades. We haven't invested in our schools, just the physical structure of our schools, right? And if I could just say one other thing in terms of school nursing, do you know there's almost 57 million children going back to school in some capacity? Only 25% of schools actually even have a school nurse. 25% of schools have no school nurse at all. 35% have only a part-time. That's 60% of schools for 57 million children do not have a full-time school nurse on staff to even be participating in implementing these critical public health mitigation strategies. Only 40% of schools have a full-time school nurse, and their caseloads are enormous, enormous.
We were talking earlier with Dr. Sam Maldonado. He's a pediatrician, and he was talking about how young kids are rarely tested in schools, yet they are known to carry virus and are very often asymptomatic. I mean, to me, Robin, you have said that this is like a big experiment that our kids are.
It's a big social experiment with no. And if we were putting this before a university as a true experiment and we were asking for institutional review board, which is an ethics review board, these are human suspects, we're dealing with humans, right? but we would never pass an ethics review board. This is a social experiment with our children. And so it just astounds me every day that we're still in this place. And it's failed leadership at the highest levels. I mean, I want to believe in the CDC and the FDA. I don't want to question our tried and true public health institutions, but here we are.
Well, and particularly at risk are school nurses and teachers. We also talked to Dr. Sam Maldonado earlier about how his sister, a teacher in a school in Texas, contracted COVID, and she doesn't know for sure if she contracted it from the kids because they don't test the kids.
Because you're not going to know.
So what is it like? Yeah. So what
Right.
is it like for school nurses and teachers right now during COVID?
It is truthfully terrifying. School nurses and teachers are doing their best, but we aren't given the tools that we need. Where is the absolute testing, contact tracing, quarantining, and isolating strategies? It's not happening. And I've gotten private messages from school nurses who are being told that they are not allowed to contact the health department. I mean, there are things going on behind the scenes that are very concerning. And we need to bring these things to light because this is all about our children's safety, our staff safety. We have to, every decision we make about school must be centered in safety. And right now, it feels much more politicized. Even wearing a mask, we cannot decide as a country that we should be wearing masks when we know and that's what other countries did, and that's why other countries are so far ahead of us. Do you know that COVID is now at least the #1 or #2 killer in the United States?
Yeah. Robin, do you think that school staff have the PPE that they need? And do you believe that there are ways to create safe environments in school for kids?
So #1, no, schools do not have the safe PPE that they need. And if this coronavirus, as we believe it to be, but the CDC has now walked it back, is truly airborne, then guess what? Facial coverings and gaiters and things that kids are wearing at school, they are not sufficient. We need to really address how we can all be safe. And so there are spaces where I think we can do this safely, and they're typically in very small schools. I think preschools and daycare centers have shown that they are able to really address this because they're small. They're keeping their classes to 10 and under. They are actually able to bubble these groups. They can work with the families. I mean, a lot of this has to do with what happens when school ends. We can do everything possible to keep everyone safe during the school day, but we're guessing because we're not testing. So we are using what's called universal precautions. We assume that everybody has COVID, right? That's really what that means. But everyone doesn't have COVID, and we don't know who does. But when we leave school, our families, are they using the same mitigation strategies? You hear about these football games and other sporting events and weekend activities. And listen, I know, I'm a parent too. Our kids want to enjoy. We've been cooped up in bubble wrap for 6 months. This is really hard. But if we're not working on a national basis, that's why this is being delayed unnecessarily. We don't have to be here.
Robin, a lot of people are doing pods with small groups of kids and hiring teachers. What do you think of that idea?
So I think I understand that privilege allows people to do certain things. And I have to say, I heard somebody say, oh, we're all in the same storm. Oh no, we're all in the same boat, they said. But the truth is, we're not all in the same boat. We're all in the same storm, but some of us are riding out the storm in a yacht, and some of us are hanging by our fingertips on a buoy in the middle of the ocean. And that's where the absolute disparity and the inequity has come to light. And so, yes, if you can afford to pod your kids in a separate school, I mean, that's a wonderful thing, but that doesn't happen everywhere. It certainly doesn't happen in Camden, New Jersey, where I am a school nurse. But, we have so much to learn from COVID of the things that really that were not handled properly, that the public health messaging that was confusing, the lack of a national response. But having said all that, we want to be back in school. School is such an essence of our country. Public education is so important. So can we agree as a nation to care for each other? Can we have some self-compassion for our teachers and our staff and our school nurses when we are letting you know that there may have been an outbreak? Some families are getting very angry because I think we're all our nerves are frayed and we're kind of at the edge now. It doesn't take a lot to push us over, but we need to come together and work on the same team to keep your children safe, but also the entire school community.
Couldn't agree more. Robin, I have one more question from someone who's watching right now. BJ Bailey from Facebook asks, what could be done better with virtual schooling?
Yeah, there's a lot of lessons to be learned about virtual schooling. And it definitely takes, I think what's happening right now with virtual schooling is that there's a combination of some are doing hybrid, and at the same time, there are families that are, and rightfully so, they're afraid to send their kids to school, so they're choosing virtual. So some teachers are actually doing both within one day, and they're vastly different. One of the things that COVID has really shown is the lack of equity in terms of access to the internet. The internet should be a utility like gas and electric. What are we doing? We must be connected. So there are big social issues that we need to address in this country, and internet access is one of them. Having accessibility to even a tablet or to a Chromebook, is another one. The lessons learned, I think we're going to be studying them and talking about them for years to come. We still look to 1918 flu, and actually, did we learn the lessons of 1918? Right now, from my vantage point, it doesn't feel like we did.
Robin Cogan, aka the relentless school nurse. If it were up to me, I would appoint you to the coronavirus task force immediately, but unfortunately it's not up to me. But we so appreciate you taking the time to be with us. Such helpful information. Thank you, Robin.
Pleasure. Thank you.
Thank you. It's been another very enlightening episode of The Road to a Vaccine, and I want to thank all of our guests for being here and to all of you for watching. Please stay safe and please continue to wear your masks. I'll leave you with this testimonial from teachers on their experience during COVID. We'll be back on October 6th with a new live episode of The Road to a Vaccine.
My job as a teacher has changed exponentially since this pandemic began. Every single day, it looks different.
Educating has been a challenge, more so in the beginning. Going into the 2021 school year remotely, I feel more confident and less anxious.
In a way, even though there was more distance between myself and my students, it actually brought me closer to them and to their families.
In the spring, at least, we had many months together, so that connection could kind of continue through the remote learning. But now in the fall, we haven't had a chance to make that one-on-one personal connection. I want them to feel like their days have purpose and that they have connections that they're making with their peers. And I just hope that they find a way to do that through technology.
Some of our kids were impacted by COVID-19 personally, with people in their family being affected. So working with them, showing them that support, that we're here for them, has definitely been a huge impact on keeping our scholars still wanting to learn during this time.
Teachers out there want the best for the students in their classrooms, and they are constantly working tirelessly all day into the nights to make sure that they are there for their students in more ways than just academic.
What I've learned is that kids are extremely resilient. I have taught kids who have been through impossible situations, and they are resilient throughout. They come through on the other side, even when it doesn't feel possible.
If there's one thing I would tell these parents, is just to stick with it. This is a challenging time, but this is something that we can overcome. If we stick together, if we continue to reach out to one another, if we continue to try to communicate, we will definitely overcome this. We'll definitely get back to normal.
Just know that teachers are on the front lines right now doing all that they can possibly do.